and kind of what are the big, I guess, game changers or the things that we should really hold kids to and we shouldn't. So the green worksheet that you would have picked up on your way in is the presentation rubric. It has not changed from last year. That you'll see the front part of the rubric is really about the actual presentation itself. It's more content related. So we're looking for, do they introduce themselves? Do they clearly describe their project? Does it sound meaningful? Like not, well, I just did this because I had to do a project, but did they actually find some connection to it? Evidence that they actually did. And that's where things get really sticky. Some people are real particular about pictures. And we just want something that shows that they did the time and they did the hours. Some people have job shadows where it's really hard to get pictures places, but most of those people have come and talked to me over the time about what constitutes that. And that's why Sarah is actually one of the ones I asked to present today, because her job shadow was done in a maybe more unique fashion than some of the more typical ones. And so we can talk about how her documentation proves she did what she did. It says included scanned images or documents related to the actual project. They were told up front they had a minimum of 5 pictures, and then of course any actual documents they have should be included in their presentation as well, and or they can have their portfolios with them and pass those around the room as the presentation is happening. Evidence of knowledge gained, so again, proof that they actually learned something from what they did. If you'll flip it over. That they integrated thoughtful relationships. So in other words, that doesn't mean that they have to at the end of it say, I did this job shadow and this is absolutely what I want to do for a career. It's fine if they say, I did this and I hated it. This is not what I want to do. Here's what I learned about and why. It's also okay if they said, well, I did this job shadow and it wasn't really what I wanted to do, but during it I learned these skills that relate to the job that I want to do, and here's how. So again, she will do a great job of going through all of that for you. And then at the end, there's always an opportunity for staff and students to ask questions, and it's just the idea that they're able to answer questions with some sincerity, and again, just kind of reflect on their experience. The lower portion, presentation skills, that their voice can be heard clearly throughout the room. Probably one of the bigger ones is that they are presenting themselves in a professional manner and what that means. If they did a job shadow on welding, we do not expect them to come in a suit and do a presentation for you. That's not realistic to the career that they're hoping they go into. So we have some kids that will come in scrubs, in actual outfits that relate to their jobs. If we have somebody who did a job like maybe community service and they want to come in wearing jeans and like a t-shirt that says Habitat for Humanity because that's what they did their 20 hours on, that's okay because it ties directly. What we're avoiding is the kid who looks like they just rolled out of bed, haven't showered in 3 days, and didn't even care to like put a comb through their hair to show up in front of you. So I always tell the girls no yoga pants. I tell the guys if possible not to wear jeans. The girls should know not to wear jeans, but if that's the only thing that's going to stop you from passing a kid on their presentation, it's probably not worth making them redo it for. It's good to put some comments, maybe remind them what professional dress looks like, but I don't know that that's a deal breaker as far as the presentation goes. So I'm going to hand it over to Sarah. She is going to go ahead and this counts for her. This is her actual presentation, and then we'll come back at the end and we'll be able to talk about the rubric and answer any questions and see what kind of disconnect we have. So.
Okay, hi, my name is Sarah Park, and my senior culminating project is that I job shadowed a psychologist. So the reason why I chose this was because I know that whatever field I go into, I want to be able to help people. And psychology is also a really stable career because it's in the medical field, and I feel like no matter what the generation is or the time, people are going to get sick and they're going to need help, and so it's very stable. But the really nice thing about psychology is that it's really diverse. You're never going to get 2 patients with the exact same symptoms and same levels of severity, so I think it's really fun. And I also think that as generations go on, I feel like mental illnesses are becoming much more prevalent, and personally, I don't want my kids to grow up in a society where mental illnesses aren't taken seriously, and so that's why I chose to job shadow a psychologist. So what I did was I job shadowed Dr. Kenneth Lay at Skagit Valley Hospital, and because of confidentiality reasons, I couldn't get my full 8 hours, and so I made majority of my hours up by attending 4 psych lectures at Western. After researching this career, I've discovered that psychologists are people who help others with mental or emotional issues adjust to normal life. They also make diagnoses by using the Diagnostic and Statistical Manual of Mental Disorders. And the expected job growth for psychologists is actually faster than average, which I really appreciate. And there's at least 20 different types of psychologists, and after researching every single one, I've kind of been interested in becoming a clinical psychiatrist. So this is the first lecture that I went to. It was Lifespan Developmental Psych with Dr. Goodvin, and the specific lecture that I attended was mostly about approaches on sex ed for adolescents. And there's two main approaches. There's the abstinence only, which is where you kind of shelter the kids and you kind of don't tell them and you only push abstinence. And the other approach is comprehensive, which is where you tell them everything and you kind of leave the kids up to decide after telling them everything, how to prevent things and everything. And in conclusion, whatever method you do, it actually does little to reduce sexual activity. Kids are going to have sex regardless of what you tell them. But the interesting thing was that the comprehensive method is actually a lot more effective when reducing teen pregnancy rates than abstinence only, which I thought was really interesting. She also touched on the fact that teens lately are actually sleep deprived. On average, teens need 8 to 9 hours of sleep, and today's generation only gets 5 to 6 hours, which I can relate to, so I thought that was an interesting point. The next lecture that I went to was Intro to Psychology, and this one personally wasn't my favorite just because she was going over something that I knew pretty well, which is Maslow's hierarchy of needs, and it's a pyramid of steps that people as humans need to achieve each step to receive, or to live up to their full potential pretty much, and that's pretty much what her whole lecture was on. The next lecture that I went to was Behavioral Neuroscience with Dr. Duncan, and this lecture was really interesting because it was a lot more science-based than any other lectures that I went to. And specifically, she went over neural development today, and in conclusion of what the whole lecture was about, it was that as age increases, the plasticity of your brain decreases. So in simpler terms, younger brains are more resilient to deficits. Not exactly like right after birth, but maybe toddler to young children age. That's why they can bounce back so much quickly, and that's why they can learn more languages a lot quicker than adults. And it's not pictured, but I do have proof that I went to it by my portfolio here. And I went to Intro to Abnormal Psych by Dr. Major, which was my personal favorite. She went over mood disorders today of unipolar and bipolar, and the two ends of the spectrum of bipolar disorder are depression, which everyone knows about, and then mania, which is something that not many people know of. It's the exact opposite of depression. It's a hysterical level of euphoria, and it's really weird to think that happiness can be a mental disorder, but it can be, and which I thought was really interesting. So this is me at the Mental Health Center in Skagit Valley Hospital, not college. And this is me interviewing Dr. Lay. These are more pictures of him and I. So I interviewed him with a total of around 15 questions, and I'm just going to touch on stuff that I thought was really interesting to me personally. I asked him what the minimal requirements for this career was, and he said, you have to graduate from high school, you have to get an undergrad, you have to go to med school, and then residency, and then you have to go to work, which I thought was really ironic because he did a lot more work than that. He got 2 bachelors, and he also went to grad school, so it's not as needy as he made it to be. So when I asked him why he decided to do this type of work, he gave me an answer that I really didn't expect. He told me that he thought it was going to be easy because in his 3rd year of med school, they do rotations. And psych was the easiest department because he could leave early, he could go snowboarding, and he told me, he stressed this point when he said that was the biggest misconception he's made because psych is not easy. And when I also asked him what he enjoyed most about this job, he said it's really rewarding to be able to see your patients grow and to see them get better and to know that you were a part of helping that. It leaves you with such a high level of satisfaction that he really couldn't describe to me. When I asked him what the most challenging aspect of his work was, it was that psych is very, very abstract. There are so many unanswered questions because there's not any real test that you can do when it comes to the human mind. And he said that because psych is so abstract, it's really hard. When I asked him what the most common reason patients seek him out, his answer was really shocking. He said out of all the 50 states, Washington is #1 in suicidal rates. And he said he's been in Washington for 8 months, and he's seen more suicidal tendencies here than in the last 4 years he's traveled around. And what I thought was really interesting was that he said, the scary thing about here is that when they say they're going to do it, they're not kidding. And I think that's something that we really need to bring to attention. And then when I asked him what he personally thought the most important thing to know about psychology was, he said something so profound, so I'm not going to change, I'm going to read it word for word. He said, when you cut off a finger, it hurts, and we all know it because we can obviously see the blood gushing out. When you break a bone, we know it hurts because we can see the broken bone. But emotional pain we cannot see. But by no means does that mean emotional pain is not real. The truth about it is that emotional pain is so painful that they are willing to kill themselves. If that's not true pain, I don't know what is. And I thought that was so profound. So what I learned was that psychology has a lot of different aspects to it. It's not just mental illnesses, which I wanted to be interested in. It has neuroscience, it has abnormal science, it has forensic psychology, and so much more than that. Misreadings are also really, really common, which is why Dr. Lay stressed that going to medical school and getting a proper education is so important because misreadings are only going to worsen the patient. And I learned that I actually wanted to become a psychiatrist and not a psychologist. And I was kind of originally steering away from a psychiatrist just because I didn't want to go to med school. But Dr. Lay stressed the importance of it, and he convinced me that med school is really worth it. It's worth the debt and worth all the hard work because being a psychiatrist, you get to help so much more. My future plans, I am so undecided, but it's between University of San Diego or University of Portland or UW. And I really want to pursue psychology, and I'm pretty sure that's what I'm going to pursue. These are my resources that I use for my career research. And I would like to thank Dr. Kenneth Lay. He was super, super busy, but he put aside some time for me. I would like to thank Ms. Scarborough, who was the one who scheduled me with him. I'd like to thank Professors Duncan, Goodman, Major, and Riordan for letting me sit in on their lecture, even though some of the classes were full. And I would also like to thank Frances Pimtel because she took my pictures for me. And I'd like to thank Ms. Moyer because she's given me good emotional support throughout this project. Thank you.